Hello, my name is Mitchell. I'm the exercise physiologist at Inpsiro in Lilydale. National Diabetes Week is coming up between the 11th and the 17th of July, and I thought it'd be a great way to share this video to explain a little bit about type 2 diabetes and exercise, as well as some of the fantastic services that we have here in Inpsiro. So what I do, I provide safe and effective exercise programs for those who have acute or chronic conditions, taking into consideration their age, their exercise tolerance, medical history, medications as well, or combined. So in this instance of type 2 diabetes, I provide safe programs that they can complete at home, and as well as I run type 2 diabetes exercise programs at Inpsiro. So the idea being that we want to try and promote exercise and movement to help increase insulin sensitivity at the cell level. So for someone with type 2 diabetes, the insulin resistance is present at the cell level, so the sugars glucose is unable to enter the cell to be used as energy. And what that does is, over time, the glucose builds up in the bloodstream, therefore causing damage to the vision, to the kidneys, to your feet, as well as your heart and your lungs. So exercise through muscle contractions helps increase insulin sensitivity to bypass insulin resistance at the cell level and to be used as energy and prevent complications like we just mentioned before. So lots of great benefits there. What that also takes into consideration when we're doing exercise, especially combined aerobic and resistance training, because that's what the studies have told us, it's much more effective in reducing blood sugars. We also want to take into consideration the medication and whether it's insulin or oral medications. That's something that the diabetes educator here in Inpsiro can actually shed a bit more light, as they all have individual plans suited to your goals. So for example, someone on insulin, you have to be above 6 with your blood sugar readings before you can actually exercise, as different intensities of exercise can have an effect on your blood sugars and counteracting with medication. So that's something I'm always wary of when I get someone to start an exercise program. So this current guidelines tells us 2 days a week of resistance training on non-consecutive days. So that involves large muscle groups, as well as doing aerobic training 5 or more days of the week for 30 minutes per day. So we want to accumulate 150 minutes of physical activity in that week to have a positive effect on our health. And by doing that, involving muscle groups, muscle contractions, can help influence the blood sugars over that 24 to 48 hour period. Some might spike up and then come back down after exercise. So lots of different, and that's why an individual plan, diabetes management plan, is something that we can organise for you here at Inpsiro. So lots of great benefits. It helps insulin to work better, reduce your blood pressure, reduce the risk of heart disease, and as well as manage a better weight and waist. Plus a whole lots of other things, improving your mental health as well. So it's got such a great, it's a great process to be involved in. Here at Inpsiro, we've got consider us as a one-stop shop. So we've got podiatrists here, we've got diabetes educators, we have dietitians, and we also have exercise physiology here. So we can all work together to help create an individual diabetes plan tailor-made just for you, so that you can better manage your diabetes long-term without complications. So we'll also, after this video, share some resources and links for you to follow up. But please come and see us, 9738 8801. We'd love to see you and help you, put you in the right direction through education and have a plan for you. So that's it from me. I hope you have a great day, and like to hear from you soon. Thank you. Bye.